Um, so today I'm going to talk about compassion-focused therapy just as an overview. My role at the Best Center is doing more cognitive behavioral therapy for psychosis. And what I discovered in doing work in this area and training is that there was a lot of reference to compassion-focused approaches. And so I got really curious about it and began to explore it and incorporate some of the strategies. So I thought it would be helpful. It seems like the kinds of strategies and ideas that would be broadly applicable as it relates to kind of health in other areas. So I will try to provide an overview and kind of highlight some of the highlights that I found in terms of researching it. So what I hope to do is just talk about the theory and process a little bit. Let me go back to the slide that I should be on. Sorry about that. The evolutionary and biological underpinnings and how they interact. And again, it'll be brief. There's whole volumes on this. I'm going to try to give a snapshot of it, talk a little bit about the strategies that are used within compassion-focused therapy, and then review some outcome data on the effectiveness of this approach and how it can be used. And I will probably use the word CFT throughout just to kind of save me a couple of words as I go through this for compassion-focused therapy. All right, so CFT was originally developed to work with individuals with high shame and high self-criticism. In some of the early literature in CBT, cognitive behavioral therapy, individuals who scored high, if you will, or had these traits at a higher level sometimes ran into difficulties within the therapy. And so there was a thought that adding aspects of compassion to the work would be helpful. And thinking about it along those lines, there's a natural connection to psychosis in the sense that for someone without psychosis, we talk about an inner critic, somebody who's very critical of themselves. With psychosis, sometimes the voices have very critical and shaming sort of qualities to it. So it comes across in the voice in that particular way. So that's one aspect of it. The basic idea is that training people in compassion, both as a mindset and as a skill set, can have benefits for health, physical and psychological. And that CFT, it kind of sounds like it's its own singular therapy, and it is used that way somewhat in the literature, but it seems to be described more as a multimodal kind of approach in the sense that people can use the CFT framework and associated strategies integrated with other approaches. So for instance, like cognitive behavioral therapy, and it's also used in group kinds of situations as well. So, but let me start with the framework that's often used with regard to CFT. So it's evolutionary based. So the basic idea is that our brains evolved and were organized to perform certain key functions. Now, this will be new to folks here on this call. So essentially, survival is a big part of what our brain needs to do is help us survive. So protection from immediate danger. We're all familiar with the fight-flight system. So if there's danger, heart rate increases, muscle activity gets working. If it's inescapable danger, then a different set of processes get kicked into place, demobilizing, shutting down. Another survival function is pursuing food, shelter, doing things. And then a third function has to do with relating to others. And so we're, fundamentally a social kind of species. So we need to do things in a social realm, seeking partners, caring for offspring, forming alliances, things like that. And so the idea in CFT is that brain patterns are organized in a way to meet these goals. And part of the way that they think about it in CFT is that certain parts of the brain get turned on depending upon what the goal is. So I'm going to talk about that a little bit. But first, I'm going to talk about the early emotion regulation systems, and early in the sense that they, from our beginnings, we had these in place and then they evolved over time. So one system is the threat protect system, which of course the purpose is to keep us safe. The emotions that are connected to it are anxiety and anger. And there's a certain amount of physiology that supports it, sympathetic activation, adrenaline, cortisol. And you'll note that some of those neurohormones, some of those chemicals are involved in stress responses as well. So just kind of note that at this point. CFT talks about a drive system, and the purpose of the drive system is to motivate us. And so positive emotions become linked to seeking and acquiring things. So there's excitement, pride, achievement. And so there's sympathetic activation, dopamine's involved. And so, very early on, the idea is that we have a system that motivates us to, if we're on a hunting crew and it's taking a while to hunt, we're still motivated. We have a way to keep motivated to pursue, and that drive system motivates us to complete those tasks. The third system that is talked about is the soothing system, and sometimes referred to as the mammalian or the warmth system. And so the idea here and purpose is to lower distress, to promote bonding. And so the feelings that go with it are safe, contentedness, well-being, feeling cared for. And so Parasympathetic systems involve oxytocin, which is involved in pregnancy and childbirth and so forth. These kind of caring systems are in place. And part of the thinking from this model is that the new brain competencies, which I'll talk about in a second, came from this space where people were kind of cared for and protected and had time to reflect and develop these other tendencies with the other brain capacities. And the overall idea with the systems is that they're supposed to work to balance one another. We need them all to survive, and they work best when they're balanced in some fashion. So let's talk about the balance a little bit, especially with the new brain evolution. So we have these three older systems: keep us safe, seek and acquire things, contentment, and safety. With the newer brain, kind of frontal lobe functions developed, and the language they use a lot is mentalizing capacity. So we began to be able to mentalize or to imagine possibilities, which enabled us to plan, organize things, but also to reflect on past experiences and be aware of our current thinking, all in service of improvements. And so, one of the offshoots of this is the ability, these new brain abilities, to imagine, to plan, to be mindful, and sometimes called executive functions, have led to achievements in science and developing things. Part of the issue, at least in terms of thinking about mental and physical health, is it's the interactions between the two systems that sometimes can be a little bit tricky and difficult. So for instance, in the old brain system, we have a threat bias. So it's better to be safe than sorry. So we're very much designed for threat protection, keep safe, right? Which also leads to a negativity bias. So it's actually, from a survival standpoint, to be aware of bad things that have happened so I can plan to not have those bad things happen again. So there's this threat bias and negativity bias that's driven by this older system. Now, but again, we have a newer brain, which allows us to imagine and plan. So what happens is sometimes when we get those old brain systems interacting with the new brain, our brain can get stuck in loops where we're worried about things, concerned about things. And that's where we get worry and rumination can kind of spring out. So let me give just an example of that in comparing kind of the newer brain functions with kind of the way the older system was sort of designed to work. This is our dog Butters. Very good dog in most regards. A little bit of terrier in her. And I'm going to describe a situation where Butters' systems got activated and our systems got activated. So we were at a family function. I forget what the event was, and people were arriving, and Butters comes up and drops a rabbit in the middle of the group. She's a terrier, so she went out and dug a rabbit out, brought it in, very proud, dropped it in the middle of the group. My daughter and I, who were watching, of course, were horrified. What are you doing, Butters? So our system got all activated because we were angry and upset that this was happening. Butters then, of course, her threat system got kicked in and started to kind of cower and move away. We got the situation kind of cleaned up. Long story short, took care of the situation. Within 20 minutes, Butters looked like this again, very calm and relaxed, nothing going on. My daughter and I, who were in charge of the dog, were like this. What did we do? We're terrible pet owners. How do we do this? Is this going to happen? Is the family going to be safe? What do they think about us? So the old brain that got activated with the threat protection system and drive system kicked right in. Once the threat, if you will, was removed, our brain was still going 90 miles an hour, reviewing the past and anticipating possible future difficulties or repercussions of this event. And so that's how sometimes we get into difficulty. So that's one piece of the CFT model, just as a framework that I think kind of makes sense. I think people get that pretty easily. The other thing that Gilbert and folks in this model talk about is social mentalities. And what they talk about is that our brains were organized in a way to bring certain competencies together that are guided by motives to pursue social relationships. All right. So there's a cooperative social mentality that can kick in, a competitive social mentality that can kick in, and a caring mentality that can kind of kick in. And so when these systems are kicked in, or when we face situations, depending on the context, a particular mentality can be turned on. All right. And sometimes it stays turned on. So if I have a job that's very competitive and I'm very much competing against folks all the time, I may go home and I don't need to compete with my kids and family in that kind of way, but that brain's still turned on. And I can be in that sense of there are winners and losers, there's strengths and weaknesses. There's a dominant and someone that's less dominant in this mentality. And this was designed early on so that we can think about the enemy in this competitive mode as someone I can not think about with empathy as much. Switching to a different social mentality, cooperative or caring, has a different set of competencies that goes with it. What do I pay attention to? How do we work together? If I'm in a caring mentality, how do I, what signals do I look for that someone needs care or that I need care, and how do I reach out? And so the idea is that these mentalities get turned on, if you will. And so CFT partly the aim is to help increase people's awareness of like which mentalities kicked in or what part of my brain is kicked in, and to be able to intentionally be able to switch mentalities and regulate your affect a little differently. To kind of tie it to the systems, the competitive mentality is a little bit closer connected to the threat protect system and the drive system. So it could be literally somebody's attacking you, or it could be a sporting event where you're competing. And you need to have this mindset and get the muscle activity going on so that you can do what you need to do. But it could also be in a situation where there's less of a physical threat, but you're competing over resources or who's going to get the job or who's going to do whatever. That same system kind of gets turned on. Cooperative social mentality, a little bit closer to the drive and soothing systems, and the caring mentality, much more closely linked with the soothing system. Now, think about one way to think about this is think about a situation where you see somebody succeeding at something. If you're in a competitive mindset, you might think, oh, they don't deserve that, be jealous, be angry about it. If you're in a caring mentality, if it's somebody that you care for, maybe a child or a close friend, you may feel some joy and pride in their success. But it depends upon the social mentality that's kicked in while you're in that situation. The other part of compassion-focused therapy is that kind of the idea that life experiences can lead to imbalances or certain systems being turned on more often than other systems. So conflict and suffering is a part of life. People have different experiences that can lead to mentalities being turned on more often than other things. All right, so some folks may have the threat protect system on quite a bit of the time, or drive excitement on quite a bit, and the soothing system may be way offline. The situations I think about as examples of this, I think about examples of like road rage, so you're driving and someone, maybe pulls in front of you, and that can turn into a really hostile and aggressive situation pretty quickly. And so you wonder, where does that come from? Well, think about driving. You're a little bit in the threat protect mode. These are big vehicles, people get hurt. And if your system is really amped up in that kind of way, you can get really focused on the threat protect part of it. Similarly, we've probably all been to sporting events where people get a little bit competitive and there's a lot of arguing and almost fights or fights that occur over something that is relatively minor if you step away from it. From a CFT's perspective is the part of the brain that got turned on was threat, protect, and drive, and the soothing was way offline. All right. And so part of what we want to do is like, how do we rebalance the system? So CFT provides a kind of a framework for it. So you provide some education to folks about, we all have our genetic inheritance, which we did not choose. Evolution works in a certain kind of way, and our environments and social conflicts or context influences who we become. Another way to say it is we engage in certain patterns more reflexively. All right. And our brains can be tricky along these lines, but we can learn. So the above is not really our fault, but it is our responsibility to have some awareness in how we want to respond differently. And so the basic idea is that with knowledge, we can better understand how our brain is working, and we can cultivate, and what they focus on is compassion, and be more purposeful in the way that we approach the world. So how do we do that? They talk about compassion mind training. And so the idea is first teaching about what compassion is, the sensitivity to the experience of suffering, and the desire, intentionality, or commitment to try to relieve or to prevent it. So there's an awareness and action part. So there's a series of practices that facilitate turning on the soothing system. All right. So practices involve like, what do I pay attention to? Practices that involve cultivating kindness, warmth, and openness, and kind of a regular basis. So you're training your brain to turn on that system more intentionally. Intention, what is my desire? There's a great bumper sticker I see on a car here where I work at Neomed. It says, I hope something good happens to you today. And I love that bumper sticker because it so nicely communicates that compassion mindset. Sending that message, like, hope for something good for you, I can receive that. I hope something good happens to me too. So there's a good connection just with that simple message, but there's intentionality. Behaviors that support compassion. So those are things like showing gratitude, caring for others, things like that. From a CBT standpoint, reasoning, we would pay attention to thoughts that are automatic thoughts and connect us to threat and needing to be protective when maybe we don't need to. I'll talk about imagery and sensory stuff in a second. One of the things that's worked on quite a bit is developing an internal sense of safeness. So there's safety, how to be in certain safe situations, and an internal sense of safeness. And they do a set of exercises. A very common sequence is body posture, grounding, and then breathing. just to kind of help yourself get into this mode. And I'll do this before I go into therapy sessions because, I'm pretty busy. I'm running around doing my notes, and my wife says I have kind of an angry resting face. And it's really, I'm just very focused, but it can come across a certain way. So before I meet someone I'm going to work with, I will relax myself. I'll pay attention to what my facial expression is, what my vocal tone is. And I do specific exercises like picture yourself talking to a good friend and saying hello to them in the same voice you would say to your good friend. And just notice how your body feels different. It does feel different when you do it that way. And then there's grounding strategies. Feel the chair that you're sitting in right now. Notice how strong it is. Be aware of your surroundings. So you're kind of getting solidly placed in your environment. And then breathing, of course, we know that helps to, when it's done well, activate the parasympathetic nervous system and really send the signal to the rest of our body. You can calm down. Two other practices I'm going to talk about just a little bit is mindfulness, which is its own practice, but it can be used quite a bit in compassion focused therapy. So it's the idea or the practice of turning towards experience in a curious and non-judgmental way. And so it's a common practice is focusing on one's breathing. And then when you notice thoughts or emotions or other distractions, you just notice it and then come back to your thoughts. So you don't react to it with anger, be frustrated with yourself. This is part of the human experience. Come back to your whatever it is, breathing, whatever it is that you're working on. And the idea is be curious, be accepting, and be kind. The other set of practices that are often used are imagery exercises. And so what we imagine we can experience, right? So, if we really started to describe this really excellent meal, great tasting food or something, you might, I'm kind of hungry now that we're talking about it. So our brain has a way of connecting with images that we create. And so very purposefully from a CFT standpoint, there are exercises using imagery that connect with qualities of care, caring, commitment, strength, wisdom. And then they direct these in three different ways, typically self to other. So there's a very famous loving kindness meditation where you really wish for kindness and well-being to others. There's the other to self, imagining receiving kindness from others, which by the way, tends to be one of the harder aspects of this compassion flow for many folks. And then there's self to self, treating self with compassion. And there's a link in the slide deck that you can go to. Kristen Neff has done a lot of work in this area, and she has a very lovely 3-step self-compassion exercise, which really breaks down to be aware of a moment of suffering and call it out. This is a moment of suffering, stuck in a traffic jam. We've got all that smoky particulate matter going around that we've had in the area lately. This is a moment of suffering. I'm not alone in my suffering, the common humanity. People do suffer. And then the third part, let me be kind to myself in this moment. So not make it go away, but let me be kind as I try to work through whatever it is. Not avoid, but let me be kind to myself in this moment. So anyway, that's kind of the essence of that piece. So just to wrap it up on the evaluation of things, as much as I really love the concepts here, there's not a whole lot of rigorously controlled research on it. So the first review that Catriona one I have listed there indicated there's more support for the group versions of compassion focused therapy, which kind of makes sense because there's exercises you do and you do it in sequence and you do it with a group. And they recommend at least 12 sessions to get relief from clinical symptoms. And then the second note, really from both Catriona and Liavis, there's just a lack of studies, controlled studies, looking at individual CFT as its standalone sort of therapy. There is enough observational and other studies to suggest that there are positive effects, more effective than no treatment, but the evidence is insufficient to show that it's better than another standard treatment like CBT. So it's often encouraged to be used with something like CBT. In fact, one of the controlled studies did CBT, and then the other group was CBT plus compassion focused therapy. And the one that had the combined group had a little bit better effects as it related to depression. All right, so then the last piece is just a summary. So it's evolutionarily based. I think the framework is kind of interesting and I think useful. So it's practical in a lot of ways. There is evidence to support association between compassion and positive emotions. Appears to be a little bit more support in group settings. Not enough evidence to support it as its own standalone approach, but it does seem to have some value as a framework and integrated with other forms of psychotherapy. And I'll just say, doing work with psychosis, there's a lot been developed lately on relating to one's voices or hallucinations with compassion. So it's really less about changing it, but changing the relationship with it. So rather than hostility, finding a place where there can be compassion and empathy for it. It's very difficult, but they're finding some, again, early studies, observational studies, and some benefits there. So that's all I'm going to say. There's some references, and then the very last piece, there's some links to go to. The last workbook link there from out of Australia, a whole set of guidelines on how to develop self-compassion. But yeah, explore those, check them out. I will stop here and see if there are any questions.